Hi, I'm Thomas Baldrick. Our ASH coverage continues here from Orlando, Florida. We're happy to have with us now Dr. Wei Ding from the Mayo Clinic in Minnesota. Thanks for coming by. Appreciate it.
Sure.
Let's talk about this study of yours, PD-1 blockade with Pembrolizumab in relapsed refractory CLL, including Richter transformation. This is an early efficacy report from a phase 2 trial. Let's talk first about why you chose to do this.
Sure. So this is our early phase trial. The reason that we're doing it, in 2015, CLL is such a changing world for therapy-wise. There are a lot of signaling inhibitors coming to this field. But however, we start to see more and more relapsed patients on signaling inhibitor, despite of their excellent efficacy. But how to manage those patients when they relapse on signaling inhibitor is unknown. Especially, there's a half of the patients progress on those signal inhibitor develop what we call Richter syndrome. So this is a drastic aggressive form of transformed CLL. So there's not established therapy for those patients, and they generally have very poor survival. So that's why we think a new therapy is needed. And nowadays, there's a lot of immunotherapy coming into cancer world in the last 3 to 5 years. In CLL specifically, we know of those immune checkpoint protein called PD-1 is expressed on CLL cells as well as T cells. Then we know their immune system is not normal, is being hijacked by the tumor. So we're thinking if we block it, most likely will increase efficacy. That's why we designed the trial using single agent Pembrolizumab to test the activity and safety of this drug in the relapsed CLL as well as transformed CLL. So this study basically is an early phase study testing about 20 patients using this agent. And very interestingly, we see a very restricted response on Richter patients. Basically, those highly transformed patients had excellent response to the single agent. And a lot of patients recovered their normal quality of life, their pain went away, and they go back their normal life routine. So we're very encouraged. A lot of patients already lived, per report, those Ibrutinib progressed Richter patient only have 2-3 months of overall survival. A lot of patients, when they achieve good response, they have lived more than 4 months, and some of them have lived 6 months and then continue to see response ongoing. So we're very encouraged about this result.
What is most significant of what you've learned already?
Yeah, the most significant one that we know is in the past, we always think about CLL, although it's a heterogeneous disease, when they progress, we think about there may be sort of just one disease. But now what we've seen very interesting is on the relapsed patient, their Richter phase of disease responded to this agent really well. Their CLL is persistent. So what we see is very interesting is for those highly aggressive patients don't have any established standard therapy, they have poor survival, we see excellent response. So we're very encouraged. However, those indolent CLL are continue progressing. So I think we saw dichotomized response on those patients. This is very interesting for us to think about in the future, how we design the trial and how we improve on our trial.
So where does this data lead you next?
Yeah. So because this is obviously an early phase study, we have 20 patients enrolled and 7 of them are Richter patients. We saw very good response on 1 CR and 2 partial remission. We've seen somewhere 40-50% of patients have very good response. So the first step is we're adding a Richter phase into our trial. So basically have a focused arm designed for those patients have very aggressive Richter transformations. We're going to test in a bigger spectrum to see how they really respond to those agents, specifically the novel immunotherapy PD-1 blockade, Pembrolizumab. And then next step is if we see like this dichotomized response as we initially discovered, then we're thinking to add a second agent using FDA-approved CLL agent like Ibrutinib or adalimumab to control their CLL phase, where their Richter phase disease is being controlled. So I think first testing in a focused, bigger study, and second, maybe adding a second agent to control both phases of the disease.
Now, I know it's early. What would you say the clinical implications might be of your data here?
Yeah, sure. The clinical implication is actually the novel immunotherapy may come to the CLL world, especially in the transformed CLL world. We think we're not only trying to kill the tumor cell, control the tumor cell, we're also trying to dial up the patient's immune system. We believe the triggered immune system can help to cure the cancer. So this is basically a novel direction of the cancer therapy.
Well, good luck. Keep at it.
All right, thank you.
Thank you, Doctor.